డిఆర్ఆర్ కేర్. డిఆర్ఆర్ కేర్ అంటే ఏంటి అని ఆలోచిస్తున్నారా? డి ఫర్ దామోదర్, ఆర్ ఫర్ రాధా, ఆర్ ఫర్ రామస్వామి. ఏంటి డిఆర్ఆర్ కేర్ అని చాలా మంది ఆలోచించొచ్చు. ఒక తల్లి కోసం తన కొడుకు కష్టపడి ఈ స్థాయి వరకు వచ్చారు. అతని దామోదర్, డాక్టర్ దామోదర్. తను మనందరికీ సుపరిచితమే. సాక్షిలో చాలా టాపిక్స్ మీద, ఇంపార్టెంట్ టాపిక్స్ మీద తను మాట్లాడుతూ ఉన్నారు. చాలా మందికి హెల్ప్ చేయడం కానీ, తన వ్యక్తిగతంగా తను ఎలా అంటే తను వెదిగి వచ్చిన దగ్గర నుంచి ఇప్పటి వరకు ఏమంటారు, మనం ఫస్ట్ నుంచి మన మూలాలు మర్చిపోవద్దు అంటారు తెలుసా. అలా సార్ వచ్చారనమాట. సార్ మనతో ఉన్నారు. హాయ్ సార్, దామోదర్ గారు, నమస్తే.
నమస్తే అండి గౌతమి గారు. థ్యాంక్ యూ ఫర్
సార్ ఫస్ట్ కంగ్రాచులేషన్ సార్.
థ్యాంక్ యూ సో మచ్. థ్యాంక్ యూ సో మచ్.
చాలా సంతోషంగా ఉంది. ఈరోజు డిఆర్ఆర్ కేర్ లోగో చాలా గ్రాండ్ గా ఆవిష్కరణ జరగడం అనేది చాలా హ్యాపీ అనిపించింది. ఇలానే చాలా ముందుకు వెళ్ళాలని మనస్ఫూర్తిగా కోరుకుంటున్నాం సార్.
థ్యాంక్ యూ సో మచ్ అండి. థ్యాంక్ యూ. ఐ థింక్ వి బీన్ వర్కింగ్ చాలా రోజుల నుంచి దీని మీద చాలా టైం స్పెండ్ చేసి ఫైనల్లీ ఇట్ హ్యాపెండ్ అండ్ ఐఎమ్ సో హ్యాపీ టుడే. And I'm also very happy because my mentor, my guru, Dr. Harold Morse, and I am in this stage because of him, who recruited me and brought me to South from North, and he's going to be our first speaker on this show. And I'll give a little introduction about Dr. Morse. Today I'm doing exactly what he is doing for last 40 years. So he established free clinics in Anderson and made us to, work there and help poor people without insurance. And he also goes to, poor country Haiti at least twice a year for the last 25 years. And he's been doing a great work. He was born a very rich man, but he lives a simple life. He does so many things, but he doesn't want to tell what he's doing. So he's such a noble soul. And I welcome Dr. Morse, my mentor, and run this, first healthcare show on this channel on the day it was born. Please welcome Dr. Harry Morse.
Welcome or celebrate happy birthday to this channel. I think it is a very exciting day and a very exciting initiative using the new technologies we have available to communicate with people, oftentimes in very rural settings. But just about everyone on the planet now has a smartphone. So everybody can access on their phone the YouTube channel, and this is a powerful instrument we have for public education in an effort to improve public health around the world.
Today, Dr. Morse talk about the most prevalent, and dreadful disease, which is a silent killer millions of people all over the world, which is hypertension. So please, Gautami Garu, you take the initiation and start the discussion.
Hi sir, namaste.
Namaste.
We are very happy sir. మీరు ఇక్కడ ఉండడం చాలా హ్యాపీగా ఉంది. సార్, హైపర్ టెన్షన్ ఎందుకు వస్తుంది? వై హైపర్ టెన్షన్? చాలా మంది ఎందుకు ఇలా గురి అవుతూ ఉంటారు?
Yeah, I think hypertension is not a new disease, but it is a relatively newly recognized disease. One thing a lot of people don't realize, Franklin Roosevelt was president of the United States during the Second World War, Franklin Delano FDR, and he died as a complication of hypertension because in the 1940s and 50s, they didn't realize how serious hypertension is. First of all, I think to define hypertension, a normal blood pressure, a healthy blood pressure, is really less than 130/80. If your blood pressure is consistently above that, you are putting yourself at risk for the complications of hypertension. this pressure that the blood system exhibits on the end organs, and that's all parts of your body that receive blood flow, that elevated pressure is damaging to those sensitive tissues, particularly the tissues of the heart and the brain and the kidneys.
How do you treat this hypertension, sir?
Well, the first thing you've got to do is to diagnose the hypertension.
Mm-hmm.
Because most people with hypertension don't know they have hypertension. None of us would know we had hypertension unless someone measures our blood pressure.
Hmm.
Now, if you live in rural India, probably 30%, maybe 40% of the population, the adult population, will have hypertension.
Hmm.
But unless someone goes to those villages and measures the blood pressure, these people don't know they have hypertension. And oftentimes the first sign they have of their hypertension is a stroke, a intracerebral hemorrhage that's bleeding into the brain, or a heart attack, or they just have sudden death from heart disease. So if nobody told you had hypertension, and going back to FDR, he was president of the United States and he didn't know that he had hypertension. And actually they knew his blood pressure was elevated, but no one realized so much then what the consequences of hypertension were. And Franklin Roosevelt died with a hemorrhage into his brain because his blood pressure was never treated. So diagnosis is the first thing we have to do. And I think in the clinics, I'm very proud of Dr. Nerella and his team, who are making an attempt to provide health care in rural settings to people who otherwise may not have access to health care. So screening for hypertension should involve checking the blood pressure of everyone in the village. And when we did this in rural Haiti, we'd walk into this rural village with an automated blood pressure cuff, battery operated. You push the button, it blows itself up, and it records a digital blood pressure. Some of these people had blood pressures of 220 over 120, and they had no idea that they had hypertension. And those people are at very high risk for stroke, heart attack, shortened life expectancy, and a decrease in quality of life. A silent killer, because you don't feel sick when you have hypertension, but the devastating consequences of a stroke to a rural family, a family that really depends on two caregivers, the father to be the provider, or the mother is the provider of income, and the other person is a caregiver. They take care of each other. They take care of their children. If the father dies of a heart attack, or the mother has a stroke and is paralyzed on one side of her body, she needs care now. Who's going to take care of her, and who's now going to take care of the children? It's a devastating consequence for a family in a rural village, making their poverty, which was already a difficult condition to live with, but this becomes a catastrophic event for this family. So the other challenge is you've got to convince, you were talking about education, you've got to convince this person who has hypertension, you've got to teach them the consequences of hypertension and the consequences of the stroke and the heart attack and the disability. And then you've got to convince them that they need to take medication. There are simple, very effective, very affordable medications, but you must take them every day. You don't take them when you remember. I take them 2 or 3 times a week.
Yes.
you must take them every single day because you have hypertension every single minute of your life. So these medications protect your brain, protect your heart, protect your kidneys from the consequences of high blood pressure.
బ్లడ్ ప్రెషర్ నార్మల్ అయిపోయింది అని టాబ్లెట్లు బంద్ చేస్తారన్నట్టు. నాకు
Hmm.
నార్మల్ బ్లడ్ ప్రెషర్ ఉందని. బట్ బ్లడ్ ప్రెషర్ నార్మల్ ఎందుకయింది? ట్రీట్మెంట్ చేస్తే. సో, మళ్ళా
Yes.
అది బంద్ చేస్తే ఏమైతది? మళ్ళా బ్లడ్ ప్రెషర్
మళ్ళా
పెరుగుతది.
బ్లడ్ ప్రెషర్ పెరుగుతుంది. Yes.
సో, that's the point he was trying to tell us.
Yeah. Now the GoToMe asked about the treatment. How do you treat hypertension?
Yes.
Like I say, you can't even know you have hypertension unless someone measures your blood pressure. And if you are diagnosed with hypertension, you must take medication every day. We have in our program in Haiti, we use 3 very simple medications. We only have 3 drugs on our formulary for hypertension. One of them is a thiazide diuretic. Hydrochlorothiazide is the one we use. Chlorthalidone may be a little better if you have that available in India. We don't have that widely available in Haiti. But a thiazide diuretic, a calcium channel blocker, and this is preferably one of the dihydropyridine calcium channel blockers. We use amlodipine, and amlodipine is very widely available around the world. It's a once a day medication. The thiazide is also a once a day medication. And if necessary, we have a third medication, and that one is enalapril. It's an angiotensin converting enzyme inhibitor, an ACE inhibitor, which also is a once a day medication. That's how you treat it. Is you take a pill. Most people, 1 pill, maybe 2 pills, less often 3 pills, depending on how bad the hypertension is and how difficult it is to control.
ఫ్రీక్వెంట్ టెస్టింగ్ గూడా చేయాలి అని చెప్తున్నాడు. ఎందుకంటే మార్నింగ్ ఒకసారి, మధ్యాహ్నం ఒకసారి, ఈవినింగ్ ఒకసారి. సో, అంటే అప్రోప్రియేట్ డోస్ సెట్ గానికి టైం పడతది. సో, ఒక్కోసారి డోస్ సెట్ అయిందంటే ఇంక అది లైఫ్ లాంగ్ కంటిన్యూ చేయాలి.